Hey guys, I'm Dr. Hunter. I'm a doctor of physical therapy and welcome to Keep Moving Uncut. It's Keep Moving because this video is all about things to keep you healthy, moving, staying physically active, but it's uncut because we don't do any editing, so please forgive me for any mistakes. So before we get started with our patients, I want to do a quick infomercial about using a cane. We had a question about the difference between using a cane versus a walker versus a forearm crutch, and then of course you've seen the walkers with the wheels where you can sit down, but today we're only going to talk about this. We'll do another one about the other assistive devices later, but when it comes to a cane, I'm going to show you three things that is very important to keep in mind. So the first thing is that not all canes are created equal. This is the standard tip cane, so it only has 1 point at the end. Some canes have 4 points. They're called quad canes. Some are wooden, some are adjustable. This one's an adjustable one, so I suggest that if you're getting your first cane, you don't already have one wasn't given to you from a family member or something, get one that's adjustable, because one of the most important things is to make sure it fits. So when you have your cane rested beside you, you want it to come to right here, this little bone on the side of your wrist, on the inside of your wrist. You want that cane to come right there. That's how you know it's a good height. So again, when you're having it, it's usually adjustable. You're gonna adjust the height up or down to make it fit personally for you, because the worst thing is to have a cane that you're using all the time and it doesn't fit. Again, you want the top part of the cane to come right to that bone on the inside of your wrist, and then you know it's at a perfect height for you. The second thing when you're using a cane is which hand do you put it in. So rule of thumb, if you're right-handed, put it in your right hand. If you're left-handed, put it in your left hand, unless you have a specific injury that's on one or the other leg. And what I mean by that is that sometimes you know specifically that you're using a cane because you injured your foot or you injured your knee. You see our chart behind us, so there's a host of muscles in your body, there's a host of joints. So if you've injured one of them particularly that's on the right side or the left side, then you're gonna put that cane on the opposite side. So if I've injured my left leg, then I'm gonna hold the cane on my right hand. And every time I step with my left leg, I'm gonna put the cane down on the right side. And that way it's offloading the pressure of that joint that's injured. Same thing if it was your right leg, then you would put the cane in your left hand. Again, every time you step with your right leg, you're gonna put that cane down to take the pressure off of that side that's injured. Now, if you are just having some trouble with your balance, you're stumbling more, you don't really know what's going on, then put it in the side that you're dominant. So if you're right-handed, use it in your right hand, left, use it in your left hand. Then the third and final thing is, like I kind of went into, how do you use a cane? You want to use it alternating, kind of like when you walk. If you ever watch people walk, you normally alternate arm and leg as you take a step. That's the same thing you want to do when you use a cane. Sometimes you'll see people and they're using the cane and it kind of looks like this, or you know, it looks like the robot walk. Don't do that. Start off using yours correctly. So opposite arm, opposite leg. Every time you take a step with one leg, you take a step with, you put that opposite, the cane down on the opposite side. So it looks natural, kind of like you're walking. And that's the way you will progress with it. And then as you walk faster, you'll notice you can walk faster, but definitely start off with knowing the correct height for the cane, right on the inside of that bone of your wrist. If it needs to be adjusted up or down, get one that's adjustable. Get one, make it easy for you. That way you don't buy one, return it, buy another one, return it. But they do make some pretty cool and fancy ones. The other thing is make sure that you're putting it in the correct hand. If you're just having trouble with your balance, just put it on either side that you're dominant, right-handed or left-handed. And then if you have an injury on one leg or versus the other leg, put it on the opposite side. Make sure that when you take a step, you're putting the full position of that cane in contact with the ground. You don't want to rock it. You want to place it down each time you take a step. All right, I'm gonna get back to work. Don't forget, if this was helpful, subscribe, pass it to someone else that you know needs an assist device. Subscribe and share it and come back. Keep moving, guys. Thank you.